I need drugs! No, seriously, I literally need to take prescription drugs. I have since I was a kid. These drugs allow me to function normally and live a relatively normal life. They fix my heartburn and my blood pressure too. By the way, did you hear they finally cured being fat? Again, it's the prescription drug Ozempic that has people shedding those pounds. We have literally found the magic bullet to control one of the most common problems known to mankind. These drugs are invented and made by a group of corporations lovingly known as Big Pharma. Pfizer, Johnson & Johnson, Merck, Novartis, Bristol Myers Squibb, AstraZeneca, GlaxoSmithKline, Eli Lilly, Moderna. These are the names of some of the biggest pharmaceutical companies that have absolutely changed the way we live. About 2/3 of Americans take prescription drugs. That's a lot. The most prescribed drug is a drug called Lipitor. It lowers your cholesterol and keeps you from dying of a heart attack. Life expectancy has gone up 10 years since 1950, and a lot of that has to do with prescription drugs. And we're getting to the point where science is moving so quickly that soon we'll have drugs that are going to cure diseases like cancer and diabetes. It's inevitable. Now, with all these obvious benefits, you would think that Americans would hold up the manufacturers of these drugs as heroes. They are literally keeping us alive. Being alive is good. Despite that keeping us alive thing, many Americans absolutely hate pharmaceutical companies. Even prior to COVID, the pharmaceutical industry was one of the most unpopular in the country. So why the animosity? Show me on the doll where the pharmaceutical industry touched you. Why do so many people hate companies that keep us healthy and pain-free and give boners to people who couldn't previously get them? Obviously, the first reason is cost. So a lot of people need these drugs to live, and much of the time the medicines are wildly expensive. People are like, why am I paying $100 for a bottle of tiny little pills? If you don't have health insurance, some of these drugs can be completely unaffordable. A lot of people blame Big Pharma for the price tag and view them as evil for-profit companies that make too much money off of our health. And most people feel kind of entitled to being alive. So it's an unwelcome surprise when people find out that healthcare is a commodity that has a cost. A lot of the animosity towards Big Pharma started on the left, where they view healthcare as a right, which is ridiculous because unless there's profit involved, you're not going to get the innovation and risk-taking that's necessary to create new drugs that improve our health. Seriously, who's going to do it for free? Without being able to profit, we'd all be living shorter, more painful lives. See? Capitalism. It's really not so bad. Because Americans are mostly compassionate people, though, we see sick people and we see that we have the most advanced medical system in the world, and we get understandably upset when we hear that some Americans don't have access to life-saving drugs. So we automatically assume that pharmaceutical greed is the reason for the high costs because that's what the left has trained many of us to do. And yes, it's true, the pharmaceutical companies make a lot of money, but the pharmaceutical industry isn't even in the top 10 when it comes to profitability. Creation of life-saving drugs is hard. This isn't meth. You can't do it at home. It requires a lot of overhead. It's a long and expensive process. It can take a decade or more for a new life-saving treatment to get to market because the pharmaceutical industry has to do extensive research and testing to make sure that the new drug isn't going to turn you into a vegetable or make your pancreas explode. It doesn't help that the government regulates the hell out of the process of creating new drugs. This makes the process of development even more time-consuming and expensive. The government holds itself up as being morally righteous for demanding that prescription drug prices go down. But they're part of the problem. Drug prices would be a lot lower and a lot of new life-saving treatments would be on the market if the government would get off the industry's back. When the drug is finally ready for market, the companies have to get the word out to patients and doctors. So they spend a lot of money on advertising. A lot of folks don't think this is appropriate, but if I'm suffering and I hear about a new treatment on TV and that treatment ends up helping me, I'm happy I heard about it. Not you. I'd rather be sick. You know those pens with drugs' names on them that you see in doctors' offices? That's to let doctors know that there's a new drug on the market that is going to help them do their job better, and patients know that the drug is new and available. Pens are not free. Although, come to think of it, I can't remember the last time I bought a pen. I think I've stolen most of the pens I've ever had. That's not good. Next, most pharmaceutical companies are American and other nations have price controls on those drugs. The pharmaceutical industry has to make that money up somewhere, so American consumers are forced to pay more to make up for the fact that the other countries underpay. I'm paying for your drugs, Finland. A thank you every once in a while would be nice. Finally, the costs of prescription drugs are impacted by what are known as pharmaceutical middlemen or pharmacy benefit managers. These guys work for the insurance companies and negotiate drug prices with the pharmaceutical industry. It's not not entirely clear whether pharmacy benefit managers lead to an increase in the price of drugs or lead to lower prices, and to what extent. It's also a needlessly complicated process, and it's very boring, so we're just going to move on. So cost is a huge factor, but trust in these companies has also fallen dramatically over the years. In the early 2000s, the painkiller OxyContin hit the market and was promoted using less than savory methods by the drug maker Purdue Pharma. This led to millions of Americans becoming addicted to opioids, which remain a huge problem today. While opioid painkillers work tremendously well and have made life bearable for people suffering from incredible pain, the pharmaceutical companies as a whole took a big hit in their reputation, despite the drug itself being a miracle of modern science. Since then, people have become more and more conspiratorial when it comes to pharmaceuticals, like this asshat. Misconceptions about the COVID shot killing people or not working became commonplace and politicized, despite the fact that the shot itself saved many lives and bad reactions were incredibly rare. But people made up all sorts of conspiracies about the shot, that it hadn't been tested adequately, that it wasn't necessary and was just a big profit grab by the pharmaceutical companies, that it impacted fertility, that it altered your DNA, that it made you magnetic, and my favorite, that the vaccine contained microchips that Bill Gates could use to track people around the globe. A plot worthy of a Pierce Brosnan-era James Bond film. Most people, including myself, don't really understand how drugs work. People fear what they don't understand, and that's where a lot of these conspiracies come from. People have vilified Big Pharma as having some nefarious plan to keep us all sick and hooked on medication and treat our maladies, while the cures have already been invented and are being hidden away in some lab at Pfizer. Others, like commentator Matt Walsh, believe that America is overprescribed, that many of us don't really need these drugs. This is a common theory when it comes to antidepressants and drugs used to treat attention deficit disorder. It stems from an old-fashioned mindset that suggests if you're in emotional pain, you should just suck it up and be happy. Oh, okay. But take it from a guy with first-hand experience. Clinical depression is very real, and these drugs work incredibly well. Maybe some people who are prescribed these drugs don't need them, but that doesn't hurt anyone. So shut up, dude. Pundits like Walsh also believe that prescription drugs like antidepressants are actually causing psychotic breaks in kids, leading to school shootings and other dangerous behaviors. But just like with the COVID shot, there is absolutely no evidence that there is any connection. Correlation is not causation, no matter how much you want it to be. So the hatred of Big Pharma comes from a lot of places, but it's irrational. It actually shows you how great we have it in this country. We have the time and energy to get mad at entities that help us live longer and feel better. The pharmaceutical companies have become a boogeyman when the chances are that the people who are criticizing them are using products created by the industry itself. I'm Dan Joseph. Please subscribe to the channel by clicking the little red widget and leave a comment down below. Also check out my podcast, Dan Joseph's America. The link is also below.